As a young girl growing up in Waterbury, Connecticut, Sandra Burke dreamed of becoming a scientist. By following that dream and focusing her efforts on the treatment and prevention of cardiovascular disease, she has made a positive difference in the lives of thousands of people. Cardiovascular disease is the leading cause of death in women, claiming 500,000 lives in the United States and more than 8 million worldwide every year.
The prevalence of cardiovascular disease and stroke in women is much more severe than people have the tendency to understand. It's known that 1 in 3 women will have a cardiovascular event versus 1 in 30 women who will die from breast cancer, for example. It is a major issue that more and more women and more physicians need to pay attention to.
Dr. Sandra Burke has made it her lifelong mission to provide products that aid in the fight against cardiovascular disease. Today, she is a cardiovascular physiologist with more than 20 years of research experience, multiple academic publications, and 5 pending patents. And in her role as Director of Cardiovascular Systems Research for Abbott Vascular Devices, Dr. Burke has been instrumental in the development of one of the newest tools in the fight against heart disease, drug-coated intravascular stents.
I recognized very early on in this drug-eluting stent program that Abbott had a drug that had the appropriate mechanism to block the cell growth that will ultimately close the stent and close the coronary artery and prevent blood flow. And when I realized that this particular drug that we had worked on earlier in the mid-90s would very likely be meaningful and be useful on this particular platform, it was an absolute thrill of a lifetime.
These devices, tiny wire mesh tubes used to help keep arteries open following an angioplasty procedure, are coated with a novel compound that helps reduce or eliminate restenosis, a reclosing of the affected arteries that can occur in up to 30% of stent patients. Her work has brought Dr. Burke recognition with Abbott and in the wider scientific community. She is a past recipient of Abbott's Chairman's Award. She is also a member of the company's Vollweiler Society, a group of Abbott's most respected scientists. But Dr. Burke recognizes that she can have an even greater impact on people's health by going beyond her research, devoting herself to the prevention of cardiovascular disease as well as its treatment. A highly sought-after lecturer, Dr. Burke takes every opportunity she can, speaking to people of all ages, genders, and backgrounds, to talk about the importance of taking care of the heart. Every summer, she takes part in the Lake County Urban League's Camp Smart, which serves a multicultural group of 4 to 12-year-old children. As part of this program, she shows the children a model of a heart and coronary arteries, talks about how the heart functions, and includes information about eating right. In early 2005, she was invited to speak for the American Heart Association's Go Red for Women event, to help raise awareness of heart disease as the #1 killer of women. She has been featured in both Working Mother and Fortune magazines. And in September 2003, she received the Women of Color Emerald Honor for Career Achievement. With this solid record of accomplishment, it should come as no surprise that she also serves as a role model to students in the community. Speaking at area high schools and student forums on career opportunities in science, Dr. Sandra Burke stresses one important point to women of all ages. If I can do it, you can do it.